Hello, For Your CNA fans, and welcome to today's episode of Workplace Wednesday. I'm your host, Miss Patty from For Your CNA, and today we're talking to Leah, who is a CNA at a local rehab nursing home, and she's going to tell us all about her day-to-day care in that setting. Welcome, Leah.
Hello.
How are you?
I'm very good, thank you.
Great. So tell me a little bit about what you are. What is your title, and how long have you been a CNA?
Right, so I'm a CNA at a nursing home, half rehab center. So half the patients will be there until they pass away, and the other half, let's say maybe they had a hip injury, they had a fall of some kind or a surgery, they get some kind of physical therapy, and then eventually they will go home. And I've been doing it for a month.
A month, okay. So you're pretty new at the CNA thing.
Yes, it's true.
So you just got certified a month ago. This is your first job in healthcare. So what has been your biggest challenge transitioning into a healthcare setting?
I think the hardest part for me was memorizing each patient's specific needs. So, like when you first start the job, you have like this orientation period where you follow another CNA and do their job with them. And they always knew, like, this patient needs this and this patient needs that. And I felt kind of lost because I didn't know any of them, because it's like, 60 people I just met all at once, so I don't remember what everybody needs. But now that I've done it for a while, I always remember, okay, this person always needs this and this person needs that. So I feel like once you've memorized your patients, it makes your life so much easier. Wonderful.
Great advice. So what side do you normally work on, long-term care or rehab?
I really do half and half. So I really do. Sometimes it's literally every other. I'll do like rehab one day. The next day I'm in, long term. It's really pretty much every other. But like I feel like I enjoy the switch because then you don't get too bored staying in the same thing.
Right, because one side is very routine driven.
Right.
Same thing every day.
Yes.
The other side, your patients are changing frequently and their needs are changing as they're getting better or getting worse.
Right.
So it does give you two completely different types of nursing. What kind of challenges do you find in that particular setting?
In the long term or the rehab?
Either one.
Well, I think the challenge for long term is just finding the time to do everybody, because like where I work, every 2 hours you do your rounds. So, and sometimes it takes like an hour and a half to get everybody. And sometimes in the middle of doing your rounds, somebody's like, well, come do this and come do that and come do this. And then when you finally come back, you're like, wait, who was I on? Who has changed? And so over time I've learned I have this little booklet in my pocket where I write everybody and when I went down. That way, I don't waste any time wondering where I left off.
Explain to me or our listeners who aren't aware, what is rounds? What does that mean? What do you do?
So every day you essentially have 5 rooms, which is 10 patients. And so that means that every 2 hours on the long-term side, I go and check every single patient. Make sure if they have a brief and they're wet that I change them and clean them up. Make sure that if they're one of those patients that need a turn every 2 hours, that you are turning them so they don't get any bed sores, or just checking on them because some of them are fall risks. So you got to make sure that they're in the bed and in the center and that they're safe.
Okay, very good. What about vital signs? Do you do a lot of vital signs?
On the long-term care, actually no, because the nurses do the vital signs for themselves. But on the rehab side, you do vitals as soon as you come in.
Okay.
So I start at 3, and the first thing I do when I come in is I do vitals for everybody and get everybody fresh waters.
What are your future goals? What do you see yourself doing in a few years? Are you going to stay in this setting? Are you looking to transition maybe to a different workplace setting?
Well, I just know I really love being with the people. So I'm going into the LPN program, and then I'll do the RN bridge, which is what my desire is. But I'm trying to figure out where's the exact right place, because I know in some places the RNs pretty much just pass pills and that's it. And then other places they really get to be with the patient. And that's the part that I want, is the part where you're really with the patient and you're helping people. I don't want to just give you pills and leave you,
Right. So you want to focus on a aspect of medicine that's very patient care oriented. Yes. And I understand that that's a big part of what you do now as a CNA. In the setting that you're in, is they tend to look at you for some of the patients that are a little bit more difficult, require a little bit more patience. So can you tell us a story maybe, or give us an example of how it's, how your listening skills and how your caring has come across in healthcare?
Right. Okay. So it's very frequent that when we have a combative patient that they give them to me, and I think it's because they think it's because I'm pretty. So they're nice to me because I'm pretty. But I think the truth is it's just because I actually listen and I really care. I'm not just there to get money. I'm not there to just, wait, ready to clock out and go. I actually enjoy taking care of people. So there's this one incident where I had a patient who was really, had history of punching CNAs, very mean, would call very, words I can't even say. And all he wanted was his clothes because he was constantly wearing the hospital gown, and he didn't like wearing the hospital gown, which is understandable. And so he would always say, "Where's my clothes? Where's my clothes?" And all the CNAs would just go to laundry and say, "Do you have this patient's clothes?" And laundry would say, "I don't have them clothes." And so, this has been going on for 2 weeks. And then when I had this patient, I just asked them, "Can I have your permission to look through your drawers?" Because I knew they weren't in laundry. And so the first drawer I opened, there's all his clothes right there. And, as soon as I got him, dressed up and cleaned up in his own clothes, he was immediately calm and, peaceful. And he actually, grabbed me by the hand and said, "Thank you so much. All I wanted was my clothes." And, he was unable to get up out the bed to check his drawer for himself. So it was a little frustrating to me that his clothes were in his own room and nobody even just opened a drawer. They just wanted to push the light off. It's like they just want to get in there and get the light off so they can call that room done. But
so that brings up a whole very interesting point, is when we're CNAs, it's not just about filling the water glass or checking the brief or turning a patient. There's so much care that goes into that patient care, and part of that is listening. Mm-hmm. So I think that the most important skill a CNA can have isn't learning how to give a partial bed bath. It's learning how to listen to what your patient needs from you.
Right. And I know something I think about is you have to remember that sometimes this is their home. They live here, and some of them are there for a whole year or longer. And so I try to think to myself, this, even though because the rooms are separated, so you have 2 people in one room and it's separated by a curtain. Some people open or close them depending on if they're close to the roommate or not. But this little space here, this is their house, and I'm invading their house. And you got to think to yourself, if you're constantly uncomfortable 24/7 in your house, you're not going to be a happy person.
Right.
And I also think to myself, one day it might unfortunately be the case that that's my dad in the bed or that's my mother in the bed. So I think if this was my dad or this was my mom, how would I want the CNA to treat them? And so that's why I really try to look at them as my family.
Great advice. And if you keep that, front and center, you're going to be an excellent caregiver, because it really is all about the patient at the end of the day. Well, thank you so much for coming in and talking to us and telling us a little bit about what you do on a daily basis in that setting. We really appreciate your time.
Thank you.
Well, thank you for joining us today, YouTube fans. And if you liked this video, give us a thumbs up, leave a comment below, let us know what you liked and what your experiences have been. Maybe you've worked in long-term care and you'd like to share your experiences as well. Or if you have a suggestion for an upcoming episode, leave us a comment below. Like and subscribe to our channel, ring the bell for notifications. That way YouTube will let you know as soon as we get a new video up. And tune in for our other weekly series, Motivation Monday, Test Tip Tuesday, Workplace Wednesday, Newsflash Thursday, Fashion Friday, and Career Spotlight Saturday. We hope to see you at each one of those. Until next time, happy caregiving.